Hi, my name is Robert Byrne. I'm an interventional cardiologist at the Deutsches Herzzentrum in Munich in Germany, and I'm pleased to be here at EuroPCR 2016. I'm delighted to welcome Sashko Kedev from Skopje, who's a very experienced interventional operator. And today we're going to talk about the Synergy bioabsorbable polymer drug-eluting stent. Sashko, welcome. So we have a lot of stents now available for use in Europe. I know the last time I checked there was something like 29 stents that had CE mark approval for use in Europe. What's the data that we have to support the use of the Synergy stent, and how do you see it?
So I see Synergy as a very unique stent that has extensive data available. I will choose only to share with you Evolve 2 long-term 2-year follow-up that was recently presented during ACC 2016. And one single information that's most relevant for me, it's no single definite stent thrombosis after 24 hours.
And this, I think, is from a large-scale study powered for hard clinical endpoints, so it's data that we should take seriously.
Yes, it was actually a US pivotal trial for FDA approval for Synergy, so there were more than 800 patients in each group. So It was a very relevant trial.
Okay, so I think data that's relevant for our practice. So I think our group in Munich was one of the first to start working with bioabsorbable or biodegradable polymer drug-eluting stents, and we're certainly impressed by preclinical data that shows improvement in vessel healing. It's an area that we're interested in, and we're doing a study at the moment called the Synergy bifurcation OCT study, where we're examining patients at 3 months after bifurcation stenting with a 2-stent technique with David Foley in Dublin. So I think our lab will have some more information on this in the coming months. Sashko, you're somebody who's a real expert on complex PCI. So what I wanted to ask you are there any mechanical features with the Synergy stent that give you particular confidence when you're using it in the setting of intervention for complex disease patterns?
Yeah, I will speak about left main indication for this particular stent, and I think overexpansion capability up to 5.75 makes it unique from one side. On the other side, we have an evidence that we have a very good radial strength after this maximum limit. So what makes it very important, there is no significant recoil after maximal expansion, and there is no foreshortening from one side. And on the other side, you have very favorable stent struts opening toward your side branch.
Side branch access is something that always comes up when we do bifurcation PCI, and I think the statistics tell us 20-25% of PCIs will have some type of bifurcation involvement. So I think that's an important message. In terms of study, anything ongoing we should be looking out for in terms of the left main space?
Yeah, there is the ideal left main, still enrolling. It's a study comparing Xience and Synergy. And what's very important, there is only 4-month dual antiplatelet only for Synergy in this particular trial. And it will give very important information about this particular indication.
Maybe we'll finish by talking about dual antiplatelet therapy, seeing as you brought it up. And I know that there is CE mark approval for shorter duration of dual antiplatelet therapy with the Synergy stent. Can you tell us a little bit about this?
Yeah, there is currently 1-month dual antiplatelet labeling for Synergy, but it was not based on a randomized trial, so we do not have randomized data. This was obtained only from a data we have available from other trials for patients that discontinued dual antiplatelet therapy. But so far there are 2 trials. One is a senior trial that finished enrollment. It's 1,200 patients over 75 years with high risk for bleeding patients that were randomized to Synergy and bare metal equivalent platinum chromium stent. And the other one is short dual antiplatelet therapy that is still enrolling.
Okay, so I think that's a good topic on which to sum up on. With the Synergy stent, we've heard a lot of the important features for you, Sashko, in terms of mechanical integrity, side branch access, vessel healing. We have already some convincing data available to us, and we're looking with excitement now towards the coming 12 months, where we're going to have more and more data available with this stent. Thank you for joining us today.